Welcome to the Lift and Make Lighter podcast. I'm Tom Telford here with Andrea Beckstrom, the medical director of LÉVO. Good to see you.
Good to see you.
You ready?
Yep.
We're 3 years into this whole startup company. What are you learning? What are you seeing and feeling other than business ownership is really hard?
Yeah, it is hard, but it's also fun. But the most rewarding part and the things I've seen is just so many people getting help. There's a lot of challenges, though, on how to break barriers to get people to come in. Not just as a business owner, but someone who cares deeply about people suffering with mental illness. How can we get people in to share their story and know that LÉVO is truly a good place to start?
Yeah.
You can start care. It doesn't mean you'll get placed on medication. We can direct where treatment needs to go. If it's a referral for a sleep study or for hormone therapy, if it is medication, if that's a piece of the puzzle, I'm finding that providers are doing such a good job at getting people where they need to go.
Yeah. One of the things that I've recognized in the 3 years of being involved in the mental health space in Utah is that despite the huge demand for it and people wanting to get care, it's still a struggle to know. There's mass confusion about where to begin because there's such a spectrum. You have going to the emergency room if there is serious mental health challenges that are going on versus do I go to an addiction treatment facility versus an outpatient clinic. So there's lots of different entry points into the mental health system. Describe where LÉVO sits in all of it. What is our quote space that we fill in the mental health journey for people?
Yeah, I love that question because just a small survey I did, the biggest response on what are barriers to care, it was where do I start? People just don't know where to begin. A lot of times people begin at a primary care doctor, and that is great. But why come to LÉVO? Why see a specialist? Because just as you said, when people come in, we will assess the whole picture, not just mental health history. We look at social history, we look at physical health history, and that all is interconnected. That's that biopsychosocial model, which I know is spoken about a lot, and a lot of people are like, what even is that?
Yeah.
Really, it's just everything that encompasses who we are. And even from our upbringing, we look at history down to when you were born and what pregnancy looked like with the mother of the patient, that kind of stuff, how school went, those kinds of things. So to start at LÉVO is a great place, one, because we specialize in using the biopsychosocial model, and we give time to do that. So I know we say a lot, the initial appointment is 60 minutes, the follow-ups are 30 minutes. Why do we need that time? To cover all of that. And we really let the patient guide care. I know a lot of people are scared to come in because they think I'll be put on a medication. Medication can be a piece, but if someone's not comfortable with that, we recommend maybe what we think, but they guide,
Yeah.
And if they want to start somewhere else and we let them know the diagnosis, that's a great place to start. I'll get emotional because there was one client that I recently was sitting in with, and he came in and was shaking terribly. And he had done work. He'd gone to primary care and gotten some help. And then he had come in, and his parents, he's a young adult, and he said, no one's ever listened to me. And so he was sharing his story. And we do a lot of assessments on the initial appointment. We look for OCD. We do an adverse childhood event questionnaire, which talks about trauma, which I know is hard for people to talk about, but it's important because it can, depending on the score of that assessment, that can tell a lot about current functioning with your mental health. We also do an disordered eating questionnaire, which is so important also to evaluate at the beginning. And then we do of course, depression and anxiety questionnaires. There is a lot that we ask up front. And we don't dive into all of it at the first appointment, but then it gets to the root causes quicker, and we can get on the right course of treatment quicker and have people feeling better. Now, that isn't all in the first appointment. That takes often several appointments, but at least the right treatment plan is set up. If it includes medication, we refer to therapy and specific therapies all the time. If a sleep study is needed, we can do that. You know, it's all of these pieces. And me personally, over the years, I have done so many things. I actually listed them the other day of why I feel so good. I have had anxiety my whole life, ever since elementary school. And every freaking morning, regardless of me trying medication, which I have or not, I wake up with heart pounding in my chest and feeling nervous and anxious about the day. And I hate that. I've hated it forever. Lately, I haven't felt that way. I get up and I'm like, this feels weird. I actually feel calmer. And it's not one thing that did that. I listed them out, and interestingly enough, it was 20 things. I thought that'd be fun to do a spin on this and say, what 20 things? It was just catchy, and it was 20 things that I have added little by little that have helped, I think, because I'm feeling calmer. Not right now, but overall, and it feels so good. But the point being, and I'm in the field. I know the things to do, and I've done it on my own, and with the help of a sleep study and different things, but I just want people to know it takes time, but you can get there. And it's actually so fun and fulfilling to figure that out. It's made me a better parent, a calmer parent, because I'm grounded, and I've learned skills not only to help myself, but to help my kids and my husband and I, our marriage. Just we can work through things a little easier because we can stay a little more grounded. That's all from the skills and things I've learned.
Yeah.
And that's why I'm passionate about LÉVO. You know, we say assess the body, lift the mind. That's absolutely true, because we do lab work. There's so much we do to assess the body. We assess sleep hygiene. That's huge. If someone misses one night of good sleep, that is a spiral down for some bad days of mental health, which spirals into maybe poor eating or poor parenting or, plethora of things. So it's just all connected, and that's what our providers love to dive into.
There's so much there that you described brilliantly, but when you think through, two themes that stuck out to me there. One, time. Two, specialty. So describe who LÉVO employs, who actually is doing the assessment, diagnosis, and treatment, and then talk about why that time component is so key in the actual clinical relationship with the providers.
Okay. So we employ those that just want to work in psychiatry. We do have a couple FNPs, and that's key because one does specialize in eating disorders, which is key. There's not enough support there. And one is she does the mental health piece, but she also does the hormone therapy piece, which I'm just beginning that journey. And that is huge for men and women that are starting to, get older, because that affects our mental health as well, and our physical health. You just feel not like yourself. So we love that. Then we also employ PMHNPs or DNPs. So it's psych specialized mental health nurse practitioners. So they've gone to school for this. They've done clinicals in this. Most of them have worked in this even before, like in nursing or before that. And that's all we do. So we do dive into a few labs like vitamin D that can affect our mood. We'll look at those things. But if there is a physical problem that they haven't already addressed, we will refer out to their primary care or a specialist for that, just like we are addressing the mind. And I forgot what I was going to say.
There's so much there that you allude to about assess the body, lift the mind. when you think through those who are psych trained, that's all they're trained in really is psych. Why is the body so interconnected then with the body? You know, what is it, the body and mind connection that we are trying to get at when people come? Because you alluded to, you know, doing blood markers, you're looking at a number of things, but describe that a little bit more in detail of what's going on physically that would shed light onto what's going on mentally and vice versa.
Yeah, there's so many things, and that's why the time is important, because it takes many little bits of teaching, not only so the patient can grasp the information. I mean, I study this and I still have to look things up to remind myself what's my best source of fiber or, you know, different things. But the things we talk about there are education on diet. And I know there's a lot of controversy out there on diet and supplements and things, but there are research-based things, not people trying to sell their own supplements, and they do the research in their own lab. Obviously, those are going to be skewed, and there's a lot of that on social media. You have to be careful. But PubMed is kind of the Google, you know, of the medical world. And so those are research-based articles, and they're not done in a particular setting. You know, they're done in very controlled settings. And so they look, you know, you can find articles on the research on Mediterranean diet and how that affects our physical health and our mental health. The benefits of weights or some weightlifting that can benefit our mental health as well. Hormone therapy is a big piece. And then things like vitamin D. People come in and 80% of the patients I see are low. I mean, actually not low, deficient. They have none. I was in that same boat. I felt achy. I had physical symptoms of low vitamin D, but also I wasn't depressed, but I was very tired. And that makes you feel down, you know? And so just getting that up can help people. So we're looking at all of that. The other interesting thing is most people that come see us aren't seeing a primary care. They want us to do everything, which we do some physical, but they need a primary care as well. You know, if their blood pressure is high and they need to get on an antihypertensive medication, I like that we encourage that piece too, because it takes the whole team, you know? And so the time we have, we don't just talk about sleep, diet, exercise. We actually are trained in therapy. Now, this is a big question we get all the time. We get calls saying, or we get asked, oh, you're not my therapist. We can do therapy, but we don't do the traditional hour-long therapy sessions. The reason is because we are doing the medication. That takes time, not always. And some patients still come in even though they're not getting medication. They just want, I mean, not getting medication yet. They want the education piece, which is fun to do. You know, we have so much we can dive into there. We always recommend to come to us and to get a therapist for the traditional hour, you know, monthly, every week, whatever they need. But the neat thing is we are trained in therapy and cognitive behavioral therapy, lots of different modalities. So we do little bits in our appointments, which is so neat. We just do motivational interviewing for someone that needs a little boost of, you know, reaching a goal, one goal, you know, and we talk about how to break that down. We talk about skills to help if someone is feeling like they need to cut, you know, to get a release and to get calmed down. We talk about some emotional regulation skills. There's just so much that we cover there. And it's great.
When you think of the field of mental health and all of the different organizations and credentialed professionals that are in it, is there any one profession that can solve all of mental health challenges?
I don't believe so. I really don't.
I mean, I set that up, you know, on purpose because we often get asked, you know, in our society and culture, we live in a convenience culture and everybody wants a one-stop shop, you know, go into Maverick and get all you can in one place, right? It just doesn't exist in mental health. And so when we say to people, start your mental health journey with LÉVO, what we are saying is come and address the body, see what's going on, to understand what's going on with your mind. But you just alluded to it. Expect that we would refer to a mental health therapist, for
Absolutely.
psychotherapy, for primary care, for addressing these other things. So we are part of a broader collective team of professions that are out there in the space. Would you say anything else about that for families who are struggling, just in terms of set yourself up for the right expectations of who may be involved in the journey, and it's not one place?
Yeah, and I guess I should say for that, when I say primary care, I also mean pediatrician, right? They see the kids all the time. But say someone comes in, a parent brings a child in, and they see us, they'll see us for the mental health piece. And maybe they've started to discuss that with their pediatrician, but we will reach out. We love to collaborate with those on the team, everyone, What's really important about that is often we get different information than the therapist. I've run into situations where a patient has told me about substance use that they're getting into. I call the therapist and they're like, no, they haven't told me that. And then we connect the dots, and so that helps to mitigate, if it be negative behavior, or celebrate the positives and continue to focus on that. But speaking with the whole team is so important.
When you think through the barriers of entry, right? I think of our own family, our own journey, Liza and I, my wife, and our own mental health, what we brought to a marriage. Now add children into the mix, their mental health that they bring to the marriage. There's been moments where there are societal and stigma barriers that have stopped us from wanting to do anything about it. Even though we were frankly hurting, as individuals when we were young, married, or now with children, we were hurting, and yet we still struggled jumping over stigmas like going in and telling someone that you're hurting emotionally. Should medication be involved? No. Medication has a stigma associated with it. Personally, in my own journey, it has been a struggle to want to deal with medication because I was raised in an environment of just rub dirt on it, like suck it up, like just be stronger, like face your trials. That's part of our culture in Utah of just like, well, just soldier on. What would you say to people who are struggling with those same things? They're hurting and yet stigma is holding them back.
That's huge. There's a lot of things that hold people back. Telling people your most vulnerable pieces of your person, of yourself, is so scary and so hard. And being on a medication, a lot of people I hear will say, well, I'm strong enough, I can do it without. Yeah, everyone can do it without, but do you want to be losing your temper more because you're not regulated? Do you not want to get as much out of, if you're going to therapy, without it? Some can, but that can help. A lot of people here will just do diet and exercise. You don't need medication, just do those things. Yes, those can help a great deal, and in some cases, many cases, that might be the fix, but you have to be really dedicated to that and stick with it, Time is a big barrier. It's not, like you said, it's not a one-stop shop. So then you get overwhelmed with, I have to see these 3 people, but you add what you can. I mentioned I've done 20 different things that have helped, but that's over the period of years, and I've started some and stopped and didn't know if it was helping. But now as you add, things get easier, everything gets a little bit lighter. Really, it helps. And some other barriers are parents not wanting to label their child, or for them to have a crutch to blame it on ADHD, or to blame it on their depression, that they're not getting their homework done. Or they're worried about them having a label and getting made fun of. But I would do the opposite argument of, if you don't get them tested and don't know what's going on, they might be the odd one out, because socially they're having a hard time regulating. You know, they're blurting out, they're going into circles of friends and just intruding on this, and people are kind of like, whoa, hey, calling them a weirdo, which isn't true. And so that just breaks my heart. And I want everyone, that any parent that is out there wondering, should I go? Yes, go. Because I have children that also have some mental health needs, one with ADHD, I think another as well. And just to know that there's help and to set her up for success, that means the world to me. Yeah, it's not perfect, but that's going to help them in the long run. Because yeah, I have not seen diagnoses be a crutch or a label, if that makes sense. I haven't had kids come in, or parents even after they get the diagnosis, come in and say, yeah, they're not doing their homework because they say it's my ADHD. I actually don't hear that in practice. So I'm sure it could happen, and maybe it has happened, but overall, people come in and there's just relief. And I know another barrier is parents are nervous to push their child or teen to come in. You know, maybe the relationship's already strained. I get that. It's hard to always have like good connection, or, you know, they're scared that their child will think something's wrong with me. But once they come in, they actually are so fun to work with. And we can usually get to the bottom of a lot of teens, like outer shell. You know, they might resist until the parents know, I don't want to go, don't take me. But if you can act out of love, not fear, and just say, this is going to be a good thing, or maybe go yourself or go together, I don't know. But I do know once we crack the teen or the child, they usually just get talking, and you can just see the relief of just venting and letting it all go, you know?
Yeah.
So
when I think about our own family's journey, you know, for our listeners, we have 5 people in our family. We have, Liza and I, 3 children. 4 of the 5 are diagnosed ADHD. And it's interesting because medication is involved for some, not for others. But when I think about our own journey, for me to be, I did not know. I mean, I knew all growing up that I have ADHD, but until I actually was assessed, I did not necessarily, I didn't own it or claim it. And so, you know, I think about my own journey of that and what value it has been. Some people would say, well, you've been successful. You started and sold companies, like all the things, like, do the ends justify the means? And when I look back on my journey, if I would have known younger, how would it have served me differently? You know, some people would say, well, it would be a crutch, or you would blame everything on it. And in reality, I think what it have done, it would have gave me a baseline for knowing then what? Like, what am I really dealing with? You know, what is my baseline of who I am, and understanding where to go from there? So what's interesting is that in my own journey, me recognizing that I do have it and diagnosable has allowed me to connect now with one of my children and how I can help him scaffold the tools from a place of empowerment versus, well, he's struggling in school and we're fighting all the time. Like I fought my parents all the time. And what I really believed until I was 20 years old is that I was incapable of learning. So, you know, you would now, a lot of people would say now, well, who cares? You know, you're successful anyway. I know, but I was fortunate. I had friends, I had family, I had people who were supporting me get to where I am. But if I would have been that kid without the same support group and people, I for sure would have done drugs because I was looking to escape my brain, racing mind, you know? So when I think about just the implications of knowing what are you really dealing with? You know, what is the baseline versus I don't want to be labeled, or I just, you know, I don't really want to know what's going on. I'm just going to try my best. That doesn't feel empowering, you know? Right. So When you think of your own family situation, I mean, you've been vocal about anxiety in social media that you post. You've been, you've said very openly your battle with disordered eating or eating disorder. How has that helped you just to kind of know and be real with it versus, I don't know, struggling with the stigma associated with it and not allowing yourself to kind of go public with it?
Yeah, I've said this before, I used to not be able to talk about any of it. And I actually didn't know that it was kind of a social, because I'm a social person, but in school, it was the perfectionism part of anxiety. I didn't want to say anything wrong, so yeah, I wouldn't say anything, like answer questions, Man, that was a disservice because you can just learn so much from mistakes, so much growth. So by sharing and talking to others, I just realized it can help so many other people. And when I talk about it, it makes it not such a big deal. I just realize whenever I do share about it, people, one, often can relate and they feel like a relief. Oh, I'm not alone. And that makes me feel so good.
Yeah.
And so I guess that's a selfish reason, but really it's just the fulfillment I get from helping others and letting them know they're not alone. The disordered eating, was very, very hard to talk about because there was food noise through high school and into early college. But I was a healthy weight, I was doing good. But that has been amazing because I realize it helps, like you said, it helps my own kids. When I talk about it and it's not a big deal, I've taken two of my daughters to therapy. It wasn't a big deal, and I know I work in it, but speaking from a parent's perspective, my one didn't want to go. She was crying. Why are you taking me? But she wasn't going to school. I didn't know what to do. And it just helped. It helped so much. And then another one, like you said, you relate with one of your children on some of the ADHD difficulties. I've learned when I talk about it, she can voice her concerns and I see her struggles. And it just makes our relationship closer. And so I feel like talking about it breaks down barriers and breaks down stigma. And so I want to teach everyone what I've learned in my journey to hopefully help other people, And in our home, my husband has ADHD. So one of my daughters has both ADHD and anxiety. And so I love that he has it actually, because I love what I've learned from one, being married to someone with ADHD and the struggles. You have to find out that you have something can help your relationships. It can help home life. It can just make things so much better. Another interesting thing that I've been kind of reflecting on is with my anxiety and eating disorder is that we have a daughter with type 1 diabetes. And so the risk of an eating disorder in someone with diabetes is high because you're always counting carbs, but not in a macros, looking at the fitness side of it. You just have to know everything that's going in your mouth. Well, that can cause a lot of issues. And so I'm on hyper alert I have 4 girls. Of course, I'm going to be on high alert for that, but I love that I know the signs. I love that we can talk openly and that what I've learned, I can hopefully keep them away from that happening. And so, man, it's hard, all that I've dealt with, but I'm grateful for all of it,
When you think of the journey of where maybe you're at the points where you were struggling the most in your personal life or your family, and when you have moments where you feel strong, what would you say are the key things that have allowed you to kind of, I use the word scaffold, right? There's no elevator to wellness and health and everything. There is no, magic pill that you can take that just makes you healthy and well and happy. You have to build it. You have to scaffold it. What would you say are the key things that have scaffolded your own and your family's health, wellness, and happiness?
Yeah, there's a lot of things, but I feel one of the base things is to recognize and know, well, share your story, because then you know you're not alone. It's actually really common. If you're sitting there thinking, what's wrong with me? Then go find out, because that is a huge part of my scaffold. Just knowing there's something going on and then doing something about it, which is scary. I'm not
Yeah.
saying that was easy. A big part was being brave and going to therapy when I had I didn't go to therapy till we kept having these miscarriages, and that was so hard. And so I was functioning still, but I had to talk through it,
Yeah.
And so that was a huge part. And then actually just diving into everything I've learned, the more I read about diet and moving my body in a joyful way, not to burn calories, just finding things I enjoy doing. All of that makes me feel like I'm on my A game. And it makes me feel like I'm a better parent, I'm a better wife, just to have more understanding that, it's tough to navigate. And I have to kind of do a different little dance with all my children and my husband, just
Yeah.
I use the skills on everyone. So I take what I've learned in therapy and I get to use, and school, but if I were just someone that hadn't gone through school in psychiatry, I get to use everything I learn, and it just ripples these great effects into our home and into their lives, And one huge thing I've learned is, things can, as a parent-child relationship or even in marriage, you want to be heard, there's often conflict, but empathy and just being a helper and a listener regulates the nervous systems better than so many things. If you can just know how to be empathetic and not grill them about this, that, and the other, just people want to be heard. And that's a huge piece of what I'm grateful for, is hearing where they're coming from. Why are they struggling, getting their homework done? Why are they struggling being on time? There's so many things.
Yeah. So much there to unpack, in terms of just your own journey and experience. When I look back, and something that I just caught on to that you described was, you have to be a fierce learner. You have to be willing to one, we have a problem, two, be humble enough, be coachable to seek help and to reach out. And what I feel like people find is that it's less prescriptive in terms of this medication or this therapy, but it's a journey of learning, that really becomes this empowering thing. When I look back on when Liza and I were newlyweds at 22 years old, and what we were struggling with then to where we are today, it is literally miles and miles of scaffolding education, and people would say, well, why is education so important to it? And it's not just education like books or an education from going to see a certain psychiatrist or healthcare provider, but it was our learning of us, like how my brain works, how she deals with perfectionism and scrupulosity, and just how education applies to us as individuals has been such an empowering journey. Anything else that you would add to that? When you think about people who come to LÉVO, and up front they may be thinking, well, are we going to have to get on a med to figure this out, or are we going to have to deal with certain treatment that we're not interested in doing?
Yeah, I love that question. First of all, I would say, if you have any thought, if people out there listening have any thought, something's going on, or if the function of your home is just too much, something's probably going on, I don't know what. There's a lot of things, a lot of avenues that could be, but just trust your gut and get started. And so why start at LÉVO? It doesn't necessarily mean that you'll be put on a medication. It might be part of it. In my own journey, I just used movement to really treat my own anxiety, to self-medicate, which was good. Once I was out of kind of that scary eating disorder part, I just moved for joy because I loved it, and it kept things great. But then, yeah, there's been times where it's been just overwhelming, and I have tried different medications, and they weren't for me. They helped for a while, actually, to kind of calm things down. And I feel like it helped when I was in therapy, just to be able to process, learn some coping skills, and just get through that roughest time.
Yeah.
But it's not something people are scared they'll be on something forever. That's not the case. We take people off meds all the time. We taper them down. I did have some side effects, nothing crazy, but one was kind of an electric shock feeling in my arms. Didn't love that. That was from one of the anti-anxiety medications, but the dose was lowered for a bit, and then, yeah, I haven't needed those with all these other things, but can it be part of the scaffold? Absolutely. So when people come in, they're not going to be put on a medication right away. We don't force anyone to do anything. We listen, and the patient really is the guide. And we will recommend a couple different options, and they can think about it. And if they want to go the medication route, that's great. And I know it can be scary to try a medication, and we talk about the risks and benefits, but there are side effects to all of them, right? Even as simple as being a headache or some nausea, all the way to more serious side effects. But if the benefit outweighs those side effects or risks and it's helping you, then it can be a good fit if you're willing to try it. And the minute someone says, this isn't working for me, they can call. It's not like they're on it and they're stuck on it. They can call, and we can even do it. If they're feeling miserable, then we tell them how to safely get off so they're not miserable. But most of the time, we start at the lowest dose and go up so slow. Most of the time people come back and they're like, I never knew I could feel like this, which is amazing.
Yeah.
They didn't know that feeling calm or having a little boost in their mood was normal, which is so sad.
Because they're so used to just this.
Yeah. They're either so
baseline
worked
low,
up or
yeah.
baseline low, or the highs and lows of bipolar, or ADHD. I mean, there's so much you can do, and medication doesn't fix everything. That's another thing. That's why, like you said, it's not a one-stop shop. Some people need behavioral coaches. Some people need like a body double. I don't know if you've heard of that, but someone that you works alongside you or works along a child to help them get their homework done. There's so many different things that we will help you find, if you need those. But one thing that a patient said, actually not a patient, but someone that had taken medication, they said, I now have more tools in my toolbox. I'm more regulated. I lose my temper way less often. I'm learning tools to be able to help my kids in their mental health journeys. I'm healing old stuff and learning more about my particular brain on medication, and I'm going to start TMS, which is a treatment for different mental health disorders. So who wouldn't want that, right? Things are just getting more regulated in themselves and in their home. And that particular person had, when I said, what took you a while to get in for treatment? They said, well, felt guilty for doing it and too proud. They thought they could, they thought they were doing a pretty good job of coping on their own, which I get, but I love that they took the step and they were just mind blown at the benefits.
Yeah.
So
I feel like in my own journey of mental health, as I look back, I've had to scaffold discipline, right? I mean, I think of where I was at as a teenager, horrible as, student, lack of discipline, staying up, eating whatever, like there just isn't a lot of self-discipline in your life as a teenager. And so be it, right? You're learning to grow. But as time goes on and you get into your 20s, you get married, you start living, you start to realize the responsibilities that I have as an adult are heavy. And you start realizing I have to become more disciplined to be a productive adult.
Right.
And there's so much of that discipline that is part of being mentally well, right? When people say online or on social media, on TikTok, well, just eat a clean diet, drink a lot of water, do yoga, and you don't need medication or you don't need any mental health help. You can do it on your own. And I actually believe a lot of that because that's what I do for my own mental health in a lot of ways today. But to just overnight say, I can now clean eat and I can do all the right things and I have all the discipline. We all know how hard self-discipline is in our lives, and yet to be all natural, you have to be incredibly disciplined to do it, you know? So in my own journey in my 30s, I started to recognize this crushing fatigue. I was just exhausted all the time, starting businesses, being a provider. And because of the fatigue, what I started to realize was that when you're exhausted all the time, it increases your anxiety because you can't deal with stress because you're so tired all the time. Well, at that time in my life, I was like, I got to figure this out. So I actually went in and was assessed. I had all of my hormones assessed. And today, 7 years later, the biggest thing that makes a difference for me is that, I mean, I manage my hormones as much as I manage like my own financial, like my portfolio, like I manage it that close because it's made that big of a difference. Why is that? Why are hormones or even just our biomarkers so key to our mind health?
This is a sensitive subject for me right now because I am starting that journey with someone, at our office. I'm very excited about it. It's a huge wave right now, but for good reason. It's been a missing piece for a long time because doctors, OBGYNs, women's health specialists, they were not trained in hormone health, which is crazy. And there hasn't been a lot of money or effort spent on research for it, but now it's coming, which is so neat. It's important because, for so many reasons. So when, as people get older, and for women, perimenopause can start at age 35. That is so young. I had no idea. And so that can affect so many things. That can affect mood. It can make mental health conditions worse a lot of times. And then vitamin D usually goes in the pot. We already talked about that. That can make you lethargic and bring on more depression and aches. And that just, some people literally go to physicians, like primary care, because they think they have chronic fatigue or they think they have fibromyalgia.
I went for Epstein-Barr. That's what I was diagnosed with.
Just because they're like, what is going on? And a lot of times, it is the hormones. And so, it affects bone health, obviously. Another big thing is, I already said joint pain, but headaches. There's just so many symptoms. And if that's not in a good spot, it's going to be hard. Oh, and you just don't feel right. A lot of people say, I just don't feel like myself. And I hear so many feel that. So why it's interconnected and why I love that we have two clinicians that do treat HRT or, work in that field and aspect is because even when people have come in and seen us for quite a while, they're on a medication or not, but a lot of times they're on something. And they're like, I'm doing all I can with my diet. I'm trying to walk every day, but I still don't feel like myself. Hormones. And then a lot of people get on the hormone replacement therapy and they feel so much better. And I know there's controversy saying, yes, it can cause breast cancer, it's dangerous. But really they have kind of debunked that. And they use bioidentical hormones a lot in Europe. And Europe, I feel, prevents more than us. We kind of do the after everything's gone bad. We are so reactive. And so, we've had a lot of people just love the help there, and how
Yeah.
much better the brain fog can clear up. Low vitamin D can also increase chance of dementia. Who wants that? So there's so many benefits. So even if someone is nervous to do typical like anti-anxiety depression medication, even if they feel comfortable starting with hormone treatment, that's a great place to start.
Yeah.
You know, that can do
There
a
are
lot.
all of these physical symptoms that you talked about, which is what I caught on to, the fatigue. But what I recognized quickly was less about the physical components and this one key thing, which was desire. And we tend to use the word desire like sexual desire,
Yeah.
but it was just a desire to be present in my own life. You know, I get asked by people all the time, like, you know, why do you do it? You know, why do you spend time in hormone replacement? And the answer is because I wake up wanting to compete for my own life. Like the literal emotion of just, I wanted to do well. I want to have the energy for my own life, you know? And so when I hear friends, guys all the time say, dude, I just feel unmotivated. Like that's the term of the day, right? Like,
Yeah.
they lack motivation. Well, it's probable that that could be a factor of just your hormones could be off, you know? And so
Definitely.
assessing those things are just so critical. Talk a little bit more about other biomarkers, whether that's genomic testing or certain things that LÉVO is doing to further assess what's going on with you that we could help uncover that would tell a story about how you're feeling.
Yeah.
I mean, and how does genomic testing, you know, impact
Yeah.
that journey?
Yeah, that's been really great to have. So it's just a saliva swab of your cheek, and we send that in, and that shows not just what medications you metabolize well or not well. There's 3 categories: the green, the yellow, the red. So red just means often that you'll have more side effects, and that it might not even be an effective medication. So a lot of people say, oh, I'll just be a guinea pig. You know, they'll just start all these medications. So we'll try 1 or 2 because, you know, often people do pretty well. But if there's needing to be a 3rd trial of a medication, we will for sure mention that if people are interested. And some people come in just wanting that, right?
Yeah.
And so if it's in the green category, there's usually less side effects, and you don't need as high of a dose, you know, on some because you metabolize it well, that kind of stuff. There's also an added piece that's actually my favorite part of the test, and it's for the MTHFR gene. And so if you have that mutation, then you're not breaking down folic acid, which then turns, you know, and makes serotonin. So it does the same thing where it shows if you're in the green, the yellow, or the red. And so I actually had it done on myself because I was just intrigued of if I needed a certain B vitamin, which a methylated B vitamin is what we recommend. See, not even a medication, a supplement to help that MTHFR metabolism improve.
Yeah.
And so, if someone's in the yellow, we'll just recommend that. And so that can be a piece. I've had people on medication, it's in their green category, they feel good. Once we get the test back, they might be in the yellow or red for that indicator, that marker, and we get them on the methylated B vitamin, and it can help improve because they're getting more serotonin.
Yeah.
Pretty cool. And then another thing, this isn't genetic testing, but it is the QB test for ADHD, and that's been really neat. It's not a standalone test, but it is an FDA cleared test, and people come into the office. They can do it online, but most people do prefer to come into our Kaysville office. People have driven up from Draper because they want to get these results for QB test and see if they have ADHD. And so it's just a 15-minute test for children and teenagers, and then 20 minutes for adults. And it's a clicker, and you have something on your forehead that can track your movement. So it is looking at attention, activity, and impulsivity. So those 3 kind of buckets of symptoms for ADHD. And like I said, if it shows ADHD, that's great, but it has to go along with their subjective or, you know, personal account of how school was, how life is now. So that's been really neat. it's also helpful when it doesn't show ADHD, because we can move on and look at something else. And there's also patterns on it that we can recognize. Anxiety, is there maybe a learning disorder, you know? So
Yeah.
another reason why someone would come to LÉVO, even if we are, you know, there's a lot going on, and we start a med and say things are still, we're not sure if there's maybe autism or dyslexia. We don't test for that, but we also refer for that. So if you want to get that answer, then how amazing to have all that information.
Yeah.
And we refer to people we trust for neuropsych testing, which is longer testing. Yes, it's more of a cost. Insurance does cover it a lot of times, but that can be really helpful to find out about dyslexia, dysgraphia, you know, trouble writing, trouble with math skills, and what will help patients.
Yeah.
So that's neat.
It's awesome. I mean, I hear you say that, and I know, you know, that we've been at this now for a few years, and I just keep thinking of my childhood. Amazing parents, you know, I had incredible teachers who were supportive along the way, but there were certain things like ADHD, like dyslexia, that I struggled with to this day. I still have to read things a certain way, reread them. You know, my brain works differently that way. And I wish going back that some of those tools would have been there, because of just the confidence that I lacked for so long. You know, I've scaffolded it later, but early on, it would have helped address some of the other challenges that I had in school, socially. You know, just some of the stumblings that I had along the way that were challenging, that I think some of these tools and resources now are so amazing for families to have.
And it's huge that you say that, because that's exactly it. When people say, I don't want them to have a label, and there's also a big question of why are girls not diagnosed young? You know, usually that starts to come out around age 12. Boys are younger, 6, 7. But girls, even though they don't appear to have the hyperactivity often, their brains are going crazy. And everyone with ADHD, well, a lot of people with ADHD are trying to hold it together while at school.
Yeah.
And that's exhausting. And then they come home and they might blow up. Emotional dysregulation is a big thing. You know, if you have a child that just seems to lose it over everything, it might be that. And why would you want them to feel that, you know? And another hard thing is, for girls especially, it's really detrimental when they don't get looked at, because self-esteem and confidence, they just plummet, and they actually have 3 to 4 times higher risk of suicide or self-harm. 2 to 3 times more self-harm incidents if someone has ADHD that's untreated, because they feel this angst about, I'm not good enough. Why can't I do it right? Why can't I keep it together like my friend here, you know, who desk is arranged, they get everything turned in. I mean, that breaks my heart. And I actually brought this up to my husband, and I was trying to talk through stigma and barriers. And I said, well, if we would take our daughter that has diabetes, we took her right in, and of course we would treat right away. You know, why don't people do that with mental health? And he said, well, she would have died. So I understood that. But then when you look at these statistics, it can cause a lot of turmoil if it gets to that point. It doesn't always, but why have that risk, you know? And have them have this inner turmoil into adulthood when often women do get diagnosed, because they're like, what is freaking wrong with me? And nothing is, you know, but they just need to get.
But years and years, we talk about scaffolding discipline for positive mental health. If you don't scaffold it young, then you're going to scaffold coping mechanisms to address battling with, those stressors. So if you're a young girl and you are not diagnosed with ADHD, you're going to scaffold your own coping mechanisms to deal with it.
Which is amazing. People are amazing, right? I mean, that's incredible. But one thing that's detrimental to that is that they look back and have some remorse for what could it have been. You know, I mean, my husband has that. If I had been treated or been in therapy, what would have looked different? And he's successful.
Yeah.
But you still get that remorse. And me as a parent, I'm just glad that my husband has dealt with it. So I knew to take in my daughter, who I will say, it's not always about bad grades.
Yeah.
They are stellar students, and one of them we do push, the other one does it all on her own. So you're like, she doesn't have ADHD. And actually teachers told us that our one didn't have it when we were trying to get an accommodation. She's top of the class.
Yeah.
We don't see that, but at home we see the struggle. We see the procrastination. We see the emotional outbursts, you know. But you're right. I mean, people do, one of the ways to self-medicate or, have a skill to get things done, you know, the procrastination brings on that dopamine hit. That's self-medicating. But you don't want a disaster, you know, siren every time you have to get a project in or an assignment done, stuff like that.
You build the coping tools to survive the stressors. You just are going to do that.
Yeah.
And so you talk about remorse. When I look back, I scaffolded tools to be able to cope with, to your point, like if you have ADHD and you're asked to sit in your chair and be quiet in class, you're going to do that. But by the end of the day, you're going to go crazy.
All your
right?
brain power is gone.
And I did, you know, and so, I mean, my own, how I view food, my own nutrition, for many of those years was just coping. You know, I came home and just would overeat or whatever. And, you know, so yeah, I mean, you're gonna build those coping skills, in one way or another, you know. When I look back on my childhood, one of the most remorseful days that I had as a kid was, I remember I played football, and I think it was my 12 years old. And I remember my football coach coming to my house and he delivered the playbook. And I remember him leaving that day, and I had the playbook, and I remember thinking, football's over. And it was because we went from them teaching us plays at practice to, I needed to memorize what was in the book to now be a football player. And I just knew that day, like, that identity as a player, it was over, because I believed there was no way I was learning what was in that book to be on the team. You know, and so it was a slow death of like being a football player, because I didn't believe I could focus and read what was in that book that day. You know, it was just sad. It was remorseful.
Yeah.
I look back on those years and think, I wish I would have had better tools. You know, and now, years and years later, what I recognized was that I didn't scaffold the education young. And I was a kid, right? I mean, you're just going to do whatever your parents take you to have access to, but that is the remorse I hope people hear.
Yeah.
I did survive, you know, I'm fine, like I'm an adult, I'm functioning, but there's still a component there of, but I could have done something differently in those years. And to be frank, I feel like I'm fortunate because I had a lot of other social factors that were in my favor, but many, many families don't.
It's true.
You know, and so those kids may not ever get out of those coping challenges, the negative side of coping. So
yeah, and one thing is, the kids might be coping okay, right? They come up with things and are brilliant at figuring those things out, but it's not like it goes away once they're out of high school.
Yeah.
You know, young adulthood, when all those transitions are happening, that's a hard time.
Yeah.
There's failure out of college. You know, I have so many young adults that are heartbroken because they're just figuring this out.
Yeah.
Or their parents didn't take them in. So even if it's hard to take them in, to all the parents listening, I would say just do it, because it doesn't harm anything. You know, if I don't even know if kids would think, what's wrong with me? Just say we're going and getting an assessment. You know, I care about you. I just want to make sure everything's good. It's a checkup. But speaking of remorse, my husband has told this before, but when we first got married, he hadn't really hit the ADHD wall where he could still keep up and he could still cram the night before. But he had taken organic chemistry, then served a mission, and then he came back and took the second part of organic chemistry, or attempted to, I should say. And it was a dumpster fire. And me,
Sorry, Adam, I shouldn't laugh, but I get it. I've been there.
And perfectionistic me, we were literally in our first few months of marriage, and I'm like, what is happening? Like, he doesn't care. He doesn't care about school. That's not what I thought of him. And I was like, get a tutor. I was doing all the things his darling father did, who is so supportive. But when you don't know what to say, right?
For
Just
sure.
get it done.
Yep.
Get it done. I was like, let's get it done early. Anyhow, he switched majors because of that failure. And it's still, I mean, he loves what he does, but it hurts.
Yeah.
So skills would have been good for him.
It is. I mean, it's super challenging. You talked about that age demographic, even those years, when Adam was in school. Now, picture the college students, and we did not have social media like they do now.
Yeah.
So I'm trying to picture Tom at 20, 21, 22, and I'm scrolling, right? Mm-hmm. And I'm seeing like Lamborghinis. I'm seeing success, like YouTubers who are making millions of dollars. In my head, I'm trying to think, I would want to become ultra successful too, but I have not scaffolded the discipline to be successful. And so today there's a perception of, I want to be really successful and I want to do it, but I don't even have the tools to get up at a reasonable time, to get to school, right? Just, there's a challenge right now in our society of just desire and motivation. We hear about it often. Just my child is not functioning well, and yet their perception is, I want to be really successful.
Or I hear a lot from patients, my spouse, they're like miserable, not motivated, or the patient themselves is an adult, and they're like, I don't know, it's just not going for me.
Yeah. What's there? As the clinical professional, obviously there's a lot could be going on there, but big lifestyle success is a challenge because it puts people in a frame of mind of always comparing themselves. And if they don't have it all together, they don't have the discipline scaffolded yet, it feels like it's,
that's a big jump. That's
a huge jump.
You can't get there. It's all those little tiny 1% daily habits. I mean, I work in the field. I am functioning well, and it's taken me years to add on to my scaffolding and to have the capacity to do it, remember to do it all. What if it be take fish oil at night or take vitamin D or find time for movement. It's always kind of a dance, and it's even when you get it figured out, then life throws you something, right?
Totally.
Sick kids, or you don't feel well or whatever. So I would say, notice how to those that are in that age are comparing, like note it. And I actually did that. I actually was going down the route on social media of comparing, and it made me feel crappy. It made my anxiety skyrocket, my mood go down. I was seeing vacations, and I had a good life. I had a great life at that time. It was probably in my early 30s. But yet that comparison just gets us,
Yeah.
And so I would say, and then I got off social media altogether. So if you're having a hard time with that, to anyone that is right now, it'll be there if you ever want to go back. But I would truly say, check your phone use.
Yeah.
Yes, I'm on social media now, but it is so different. I'm only on there for mental health purposes and lifting and giving education and research-based tips on it. And that has changed everything. I don't follow anyone that has the big lifestyle, because that doesn't help me. It doesn't work for my brain. So
if you're feeding the algorithm these things, right, that's what your feed is going to show. And so, I mean, you and I have talked about this. We know this from our business meetings that we're in all the time. When I look back on my journey as an entrepreneur and a business owner for 25 years, investing in coaches has been enormous. People who can help me along the way build the businesses. in that way, that's what I believe LÉVO is a mind coach, that you have a team who is helping you coach and do these things, including what is in your feed. You know, when you think about social media use today, and LÉVO creates a podcast, you're heavily involved in social media, I am too. But are there other resources you would say that you like to follow or that you use your phone for good that would be helpful to others?
Yeah, it's crazy how I know that technology and all of that, there's a lot of negative, which there should be. There is, and they absolutely, it's meant to be addictive. But yes, my algorithm is all ADHD, diet for mental health, movement, motivation. It's so good. I probably take 10 things, you know, when I'm on there, just quick little blips that, yeah, you can't incorporate it all. I can't even remember all of it. But it's helpful because it's just those reminders. That actually helps me stay on track. And when I'm not having all the other noise, but it actually exhausts me. Because even then, you know, on that, I don't know what that page is called, where they just shoot so much. Like, I think I looked up one thing for Ariana Grande for Wicked, and then it was just like flooded, and I was so mad. But you have to just, it's like self-control to just look for what you want and start to search for key terms you want, and your feed will go there, and it can be helpful. I will say it's been a force for good in my life, but it's very different from when I was in my early 30s. That was me comparing, keeping up with the Joneses, needing, you know, I don't follow anyone that does Amazon links. I was just spending, it's only $20 here, but then I'm like, well, just, the stuff was too much. So I forgot your question, but.
All of that.
But I will say on screen time, that's a whole other podcast, but check in with your kids. It doesn't have to be a battle, but you can follow their screen time. Even if it's once a week, just make it like a routine thing where you sit with them. You know, you can set it up so you can see their screen time and where they're spending their time. You don't have to deep dive. You can. If they're young, I would deep dive and see what is on their algorithm. Yeah. They might have private hidden accounts. It's scary out there, but have some trust if you can, and then just find to put some borders and guardrails up for especially junior high. Like, I don't think social media, this is probably unpopular, but should be had till 16. Their brain just can't comprehend that. It would have crumbled me for sure.
Yeah.
To see who's with who, what am I being left out of, that kind of stuff. Their self-confidence is just already so low. They're all trying to figure out who they are. So and if they have it, that's fine. It's not too late though to start checking in on how much time are they on there.
Right.
You know, it's a big thing.
The reason I ask about the phone in the first place is you're scaffolding one way or another.
Yeah.
You're either going to scaffold positive coping and things that are going to fill your life with wellness and health, or you're going to fill it with stuff that is not going to be productive for you. And so as a lead-in question to that, is mental health a lifestyle?
Yeah, I saw once, like, eating a nutritious diet, you don't just do that for a little bit, right? It becomes you.
Yeah.
And I believe that. Yes, mental wellness, mental health is a lifestyle, and it takes all those pieces and doing them over and over and learning more and more to really keep up with all that the world throws at us, and our health, you know, starts to decline over time, and our mental health as well. So yeah, to keep building on that, and like you said, I don't know, making the algorithm to your favor to find things that can continue to help you learn and grow in that way. I don't think it ever ends. I think it's a continual process of, this, you know, there's always new stuff coming out too, but there's so much to learn that can help.
Yeah.
Yeah.
That's where I believe LÉVO sits, is at the coaching of the mind to scaffold the discipline. You know, in an ideal world, no one would need any mental health care, right? But how do you get there? if it's a struggle and you're battling today, you're going to need to figure out the tools to scaffold wellness. And LÉVO sits at that role of coaching mind care in the beginning so that your journey starts from a positive scaffold base, a foundation of where do I sit today in my mind health. And until you get the baseline, it's hard to start your scaffolding solid,
Yeah.
right? And so that initial scaffolding and base becomes your springboard for all of these other disciplines in your life. It's so cool that you sit at that intersection as a professional.
It's the best.
I know it's super stressful at times, but I'm grateful that you're sitting there as the mind coach, leading the team at LÉVO. It's awesome.
Yeah, it's amazing to see when people, you can say something 5, 10 times, right? We can only take in so much. Little by little, when people start to add in these little habits and helps, it makes such a big difference. I see it all the time.
Yeah.
So I do know that, just you'll hear all the time, okay, ways to help your mental health. You'll see it on so many posts. Get good sleep. Eat vegetables. You're a healthy diet and work out. Okay, but how do I do that? We hear that all the time, but what's the why? So I love that at LÉVO we dig deeper and we start with step 1 on sleep hygiene. We literally have a list and we're like, how are you doing on that? And show it to patients and they're like, oh, well, I'm on my phone till 1. Well, that's one piece, but there's literally 10 things on there that we need to chip away at. It's not just get good sleep.
Yeah.
That's also a sub-scaffold, right? And then diet is another scaffold, but you have to do one thing at a time. It takes so much time. And I don't say that to overwhelm people, but really those little things, if you haven't read Atomic Habits, to anyone listening that hasn't read that just, I don't know, kind of makes building habits seem fun almost and not as overwhelming.
Yeah.
It's just little bits,
Yeah.
because it can be overwhelming when they list off 4 things to change your mental health. Okay, that's overwhelming. I can't even get out of bed.
Yeah.
So to see people change, and I mean, I don't think I'm supposed to cry with patients, but it's hard to hold back the tears. It's just such joy when they feel even a little bit better, and they have such a long way to go and are going to just feel amazing. It's pretty cool.
It is awesome. When I think about when people come in and they're in that traumatic, they're barely in survival mode and they transform what's going on in their life to have some hope and energy and desire. When that enters the equation, it's magic.
Yeah.
It's so cool.
Yeah.
What else do you want to say? Any other thoughts? Freestyling that you want to share, that you want to address?
I guess just hitting home again on that's another thing that you see all the time on social media, the biopsychosocial model, and people are like, whatever that means, but it really does come down to that. So breaking that down, like, what does your physical health look like? Let's look at your labs, your vitamin D, your cholesterol, all of those things, hormones. Let's look at your any trauma that came up. Now, we don't deep dive into that, but we do hit pieces. But therapy can help that. What was your upbringing like? Do you have support now? Did you have support as a kid? Looking at all those pieces, there's things we can guide and help with. That is mental health. It's encompassing all those pieces. And so just realizing that one medication is not going to fix all that, but we guide to help all those pieces come together.
Yeah.
Which is so neat. I just think some people think walk in, get the script and leave and it's going to be great, right? Medication doesn't do that. It's all the pieces together, but that can be a piece that takes the edge off. And people can still function without, but are you like up here? Are you overregulated or are you just feeling terrible? It just lifts, right? It takes the edge off, so you're just a little bit in the middle. And life is better, and you do have more excitement getting up in the morning, and to live. And then it starts to snowball in a good way, and you start to think, well, what else can I do?
Yeah.
And the more you learn, the more you can do.
When I think about that description of the biopsychosocial, when I started to really feel well, it's interesting to what I've applied in those three areas, right? That the physical came together with what was going on in the mind, the psycho part of that, and then the social. When relationships and my physical health and my mental health all were in a positive trajectory, that's when I was like, I feel great in life, and it takes all of those components, to feel like you're doing well. So to say, well, I'm really fit physically, how can I be depressed if I'm really fit and I'm getting all my workouts and I clean eat? Well, it's possible that the psycho and social may be missing. And you can become obsessed with that stuff, right? I mean, there was a time where I was doing Ironman and very physically fit, and yet because I was spending so much time on my physical health, my relationships were struggling. So my social was missing.
Right.
And I felt empty. So you can't just make up, so you can't be perfect in one area and expect that you're happy, because it can be detrimental. By depositing in one area too much can be detrimental to the others. And it's just so key.
Absolutely.
What else we need to address?
I think, one more thing I would say is another barrier is people are worried about cost. They call their insurance and the insurance says, I'll give you a list of places you can go. That's the worst. You have a list of 40 names and you're like, I don't want to call these and try them out and date them all. So, we take private insurance, we take so many insurances. So it is just a matter of calling them, finding out if you have a deductible.
Yeah.
Because I know that can get expensive, while you're building up that deductible before insurance kicks in to cover some. But call and ask if our providers are on there. That just can get, I know it can get to be a lot of time and expense. Those are hard for people to look past or, get on board with. And then it can be hard when they see us and we refer to a therapist. But again, like I said, one piece at a time. If you start at LÉVO, we can give kind of what the scaffold will look like, but you're not going to do it all at the same time.
Yeah.
And we are sensitive. Some people come and they're doing cash pay or self-pay, and we spread appointments out where we can. We want to make it work. So that's a big question. And really, insurance does cover it, which is great. They cover the hormone therapy, which is unique as well. And I know it still can be a cost with those deductibles, but just call and get some information from your insurance, and that can kind of decrease some of the anxiety surrounding the cost.
Yeah, the billing team at LÉVO can be that coach to just tell you how to most efficiently address your budget and any financial constraints that you have. So instead of, no, I don't want to go in, at least make a call and work with the team to make that determination first. Is there going to be a financial barrier?
Yeah.
So
just so people know that. It just takes being brave. When people get on the couch in our offices, they're feeling, usually people wait till they're at the low before they seek care. And if you can be brave, it gets easier every time. I will say that. So yes, you just have to just do it. And then it does get easier, and you'll have so much growth from even that first call. You'll feel better just by having it set up. People have also called and canceled, people that have reached out to me and said, okay, I'm on the schedule, then they'll cancel. I get it. It's scary to talk about your stuff. I've been there before, but I know on the other side, you feel so much better. Even if no intervention is done and nothing on the treatment plan is done, the best regulator of our nervous system is empathy and being heard. And if someone is there to listen, you'll go out feeling a bit lighter. You just will. So You just have to have faith in that and believe that it will help. Our patient care specialists are amazing. They keep everything very confidential when they're talking, about it. And you can say as much as you want or as little as you want in that intake phone call. And then we do send paperwork out, and that's where you can fill out, there's a depression assessment, an anxiety assessment, your history. And if you're not comfortable talking about trauma, you can just say, yes, I've had trauma, but you don't need, we won't push you more than you can handle. We can take it little by little, but would you add anything to that?
One of the things that I love about what you post is that you spend a lot of time describing to people that your gut health is so critically important. And a lot of the time you're referring to the physical gut, meaning the nutrition.
Yes.
But what I have found in my journey with our own family is that my intuition, my gut, so to speak, about what is going on, the majority of the time is accurate. Mm-hmm. Meaning something is off, you need to address this. And I'm a procrastinator at times. I procrastinated going in for care, but most of the time when my gut tells me something is off with myself or one of my children or with my spouse, it has been accurate.
It's true.
And so to follow that and to kind of listen to your own body is critical in our own care. So oftentimes when people come to LÉVO for their first appointment, they're like, I'm going to spend an hour. It's amazing how the provider is spending time really learning what your gut is telling you about what's going on. And it's hard to say it out loud at times, but I think for people who their gut is telling them something is off, they need to go in, follow your gut, because it is your body's wisdom telling you that something is not right. And I don't know what you call that, a godsend. I don't know if it's whatever, your divine nature or something, but it's really understanding yourself, and your body and mind are telling you something is off. And so to listen is so critical.
It's true. And I would say that for parents as well. When something is off, or you have a hunch like something seems off, go with that. And just don't think too much about it. Just say 3, 2, 1, go, and make the call. And I know that that's easier said than done, but it can help. Don't sit and stew. Try not to talk yourself out of it, because I bet you'll find something.
Yeah. Andrea, when you think about ADHD testing and assessment, I'm trying to think about my own childhood and thinking, what was going on at school or what was going on at home that my parents or teachers would have caught on to? And what's the crossover of care? Because in our own family's journey, one of my children, his teacher at a parent-teacher conference, and teachers, by the way, they're in an interesting role because they're not necessarily supposed to diagnose or recommend, any sort of treatment, but in a very tactful way, she said, he's struggling with this. That led us to reach out to healthcare providers and to get an assessment that we were given by his pediatrician that we then brought back for her to fill out. Yeah. What's that called, and how does that dovetail into that assessment versus what LÉVO is doing?
Yeah, so we use that in addition to, we have the QB test, which I've talked about, that computer test, which can show ADHD, but the Vanderbilt assessment is what we give parents and a teacher to fill out separately, and then the parent will bring that back. Why that is helpful is because when you have symptoms, someone comes in and complains of symptoms of ADHD or that their child has these symptoms, you have to have it in different areas, not just at school, but how is it affecting things at home and at school? And so it's good to look at all those pieces, and that tells us a lot. On the Vanderbilt, it just has a bunch of questions, not just about ADHD, but about kind of behavior stuff as well, and anxiety, because anxiety often, and depression actually, are often comorbidities of ADHD. So when someone comes in, saying, I think something's going on, I think, There's some ADHD symptoms. We start with that. We recommend the QB test. And we do talk medication if people want to go that route. And that is something I like to talk about just openly on social media or with my friends and family, because there is a lot of misinformation on that stimulant medications are the only ones to treat ADHD. Yes, they actually are the gold standard, in studies for children and adults. And what they do is they increase the dopamine in the brain, in the prefrontal cortex, which I know people have said, well, why would I give my child a stimulant when they're already bouncing off the walls? It actually calms things down just because, they are needing to move to get that boost of dopamine. So then they can sit down and let the medication boost that. And I love one thing I heard was that ADHD is actually really misnamed. It's actually traits. I loved that. It just makes it sound, disorder is just kind of harsh, I feel.
Yeah.
And so I love that it's traits because a lot of it can be good. Creativity, you'll hear all sorts of stuff. Yes, there's difficult things like time blindness and the motivation or procrastination, but it's actually not a lack of kids or adults trying. They're actually working harder than those whose brains function naturally like that.
Yeah.
That makes me so sad. They are sitting there all day.
Yeah.
You talked about that. Just trying to keep it together, trying to stay in your seat, trying not to blurt out answers every second. And how can they focus on the work when they're trying to fit in this box that school is putting you in? There's just different types of learners. And so I liked that it was voiced as traits. I also
Hearing you describe that, to jump in, I could get emotional about this because I believed I had disorders.
Yeah.
Right? Dyslexia, ADHD, it was talked about as learning disorders, right? And yet I believe truly, as a 47 going on 48-year-old, there was a time where I was like, well, I wish I would have been blessed by God to be a good football player, blessed with this gift or this gift. Now in hindsight, I believe my greatest God-given ability was, quote, ADHD. However you describe that, those traits that I was blessed with, yes, they were hard in school when all of these parameters are stay in your seat. I mean, in any given day, I probably heard, Tommy, get in your seat. I probably heard my name 80 times a day, right? Which at the time was a struggle, but now looking back, I want people to know we're not trying to numb ADHD. There is no medication that is going to take ADHD away, but we are trying to direct the mind energy. And so what you just described as why have, a medication that would actually increase, right, an upper. But today, when I ride my bike, when I'm active, the more physical energy I exert, the more present in my mind I am. So I need to run, so to speak, to stand still in my brain.
Right.
That is such a gift, to be able to have your brain not race and to stay focused. And so whatever that is, for me, it's riding my bike or physical activity. But if you're a child who's being asked to sit in a chair and be quiet, when your brain is running 1,000 miles an hour,
so sad.
it's incredibly challenging. And so, I just say that outwardly so parents know you can't take ADHD away, you direct it.
Yeah.
You direct the energy of it.
Yeah, and it's not actually it's not a deficit in attention. It's actually, attention's great, but it's how to direct it and how to quiet everything else. So there is a psychiatrist, Dr. Hallowell. I don't want to missay that, but he talks about it as being an orchestra. He has ADHD himself, which I love, because then that's why I love having what I have, because I know how to speak about it. But he has devoted, all his time into ADHD research, and he talks about it as being an orchestra. So someone's trying to focus at school on a problem, math problem, say, and there's the fan going, there's kids chattering. So kids have plenty of focus, but they can't quiet and shush in an orchestra. It's like the horns are going, the violins are going, the tuba's going. They can't quiet the other things and just bring up the strings.
Yeah.
It's all going. And that sounds awful to me. And so it helps quiet that so you can have that function of being able to focus,
Yeah.
you know? And so I just like to talk about, I always like to educate parents that it's just not stimulant medications. We actually, at LÉVO, we usually start with some of the other non-stimulant options, because if they work, then great. And there's one that works on norepinephrine, and by getting more epinephrine in the prefrontal cortex, which is right behind your forehead, that also increases dopamine. So sometimes that medication, called atomoxetine or Strattera, can be helpful. Now, it doesn't work for everyone. I'm sure there's people that are like, oh, that med sucks. Like, that doesn't work at all. But one, were they on the right dose? And two, did they give it long enough to work?
Yeah.
It takes several weeks to have it work. You can have some benefit in a few weeks, but it's not like a stimulant where you take it and bam, that day you feel it.
Sure.
And then another type of medication, they actually were used as antihypertensive medication for high blood pressure. And they're the alpha-2 adrenergics. And so they also can help increase norepinephrine. And so they help rein in also impulsivity, attention, and can be awesome. Another good thing about those, we often prescribe them at night. The two we use are called guanfacine and clonidine. And there's extended release versions as well. But why I love these is because they're calming. So it helps calm down that impulsivity, and it helps people sleep a lot of the time. Not drugged out zombie, people, and they're not addictive.
Yeah.
These are not addictive. And so people will come back that do have children that are hyperactive, and they're staying in their seat. They're listening. And that makes me so happy for those kids, because then kids aren't like, who's the weirdo that's not staying in his seat? Like, that breaks my heart. It's not because they don't want to. So just knowing that there's other options than stimulants is huge. And yes, stimulants do have, you have to be careful, and we monitor those very closely so there's not addiction, and diversion of those. But the other non-stimulant options aren't, and they help with anxiety and ADHD if you have that, and sleep if someone's not sleeping well, because that can be common with children that have ADHD.
Yeah.
Another common thing, if any parents out there have children that have nocturia, which is bedwetting, girls with ADHD are 3 times more likely to have wetting the bed at night. And so if that's going on, they might be like, what's going on? It's because their nervous system, it's taking a little longer to develop, and that's okay. And the guanfacine can help with that as well, which is amazing.
Yeah.
So if that's stressing you out and you're changing the sheets every night, like, I don't want to do that. I would get an assessment for sure. Now, it might not be ADHD,
Yeah.
but to rule that out could be huge, or to find it early on,
Yeah.
Another question I get a lot is, well, I have late onset ADHD. Well, that's not a thing. But I see why people say that. It's because it doesn't present till later, or people are finally like, what is wrong? You have to have symptoms 12 or earlier. So if you get them thinking and talking back, they probably did. Or we get parents coming in with their children, and they're like, this is going on, they have ADHD. And then we'll say, well, which one of the parents or caretakers, well, not a caretaker, I guess genetically it would be a parent who has ADHD. And sometimes we discover it that way. So with women especially, there's this, they call it the lost generation of girls, because ADHD was studied in the 60s and 70s, mostly on boys, because they wear their symptoms on their sleeve mostly. Some don't.
The hyperactive part of it.
The impulsivity, speaking out, butting in. So girls weren't studied. They thought it was more of a boy disorder. And so there are these girls, and I still think it's kind of an issue. It's still missed and not diagnosed, because they're internally dealing with the struggle, for girls are. So this generation, a lot have come out. There's been a big surge in diagnosis because they were missed. you
Yeah.
know? It wasn't even looked at. So that's another thing. And I also want to say, if they are rocking it in school, good for them. Just because they're straight A students and doing awesome, it doesn't mean they don't have ADHD. Just don't rule it out. That was confusing for me with one, and then I'm considering another one of my daughters that I am pretty sure I've diagnosed with ADHD, but she didn't match a lot of them, especially the hyperactivity. But if you look closely, there's sometimes like the micro movements,
Yeah.
tapping the leg, picking at their fingernails. We got her one of those spinny rings. It has been amazing. It's just quiet, and she just does it all the
Yeah.
time. Otherwise, she will do these micro things that are often missed. But straight A student, her teachers on that form, I never gave them a Vanderbilt assessment, but they would have said, nope, no issue, because they don't see the struggle at home.
Yeah.
The waiting till the last minute. Another thing is people with ADHD get bored with boring tasks, right? They don't have the internal dopamine hit to do the homework. That's why it's a struggle. Or the boring, whatever class is boring to your child, they might be killing it in AP biology. But then their history class that might be really easy for them, they are failing. So there can be that discrepancy as
Yeah.
well. So interesting, not textbook symptoms, to look
Yeah.
at.
So much there in just the tailoring of every mind, right?
Yeah.
I mean, you said something very funny, but I think this is real for people listening. We get reviews online all the time. Google reviews, LÉVO sucks. They don't know what they're doing. This medication was horrible. All this, like every mind is different. And so, I mean, for people listening in or, social media, whatever, you need to know that LÉVO knows we are not the end all be all solve.
Yes.
Right? We are asking people to come to get into a process of scaffolding what you are and what you need, right? And if you're thinking that your first solution is going to be the end all be all, it's likely not the case.
Yeah.
You're going to need to commit to this long-term process of finding out really what you're dealing with. So, I mean, it was funny just to hear you say that, the different medications, the different
so much.
treatment options. There is so much to learn in scaffolding what your care is going to be needed,
Yeah, it's
to get you
very
there.
tailored to each individual. I mean, I have 3 in my home that deal with ADHD, and then we have some anxiety. It's going to be different. The symptoms are different too. You know what I mean? And I will say, I get discouraged at times, and I work in this every day, and I research it all the time, and it overwhelms me. Even though we know what's going on, it's a lot. So I feel parents and spouses that are like, oh man, this is a lot, but it's worth it. The payoff is so great if you put the time and energy into finding out what's wrong and to trying different things. We've tried several different things, and we're still not there. It's going to probably continue because actually as you grow, symptoms can, a lot of boys grow out of the hyperactivity, but then other things can emerge or things can get worse, that kind of stuff. So it's always an evolving thing, or can be.
Yeah.
So, yeah.
I love you said that because I hope people recognize in coming to LÉVO that those who own it and are running it are living in it.
Yeah.
Right? This
Deep.
is your story. It is my story. All the providers at LÉVO, these are people who are effective at what they do because they can compassionately speak from a wisdom perspective. They've lived it, they're in it themselves. And that's who we've tried to attract and build LÉVO with, is people who are in it themselves, who are willing to speak openly about their own journey. I think that that's, part of the value of what LÉVO is offering, our patients who come.
Definitely. One more thing, just I thought about stimulants. Often, there's big peaks and valleys. So people, not for everyone, but it's common. We often use extended release to kind of even that out, but you still can get it. And so when people have the crash when they're coming off the medication, they can be irritable, moody, I mean, my husband's been there where he's like, don't talk to me right now. I just need a, I'm like, oh, medication. It's just like this. It's just like this understood, like, I don't want to get in his way. He knows he's not going to be the kindest person. You know, he still is kind, but it's rough and it feels crappy. So I just want to say, if you have been on a stimulant, don't rule out these other non-stimulant options because they don't have those crashes, which is amazing. So it's worth trying them. They work differently. They might be as effective. They will feel different, but you won't feel those crashes, you know? And that can be hard with kids, or if kids have been on them and haven't been growing in height or they're losing weight. These other ones, we still track that closely, but they don't have the same intense side effect of that. But I do want to say, like, there was a teen I was seeing, and I just asked her about her room. I said, how's your bedroom? Because personal experience, I see this in my home. And I was like, tell me when you, and she's like, it's a mess. And I said, what does that feel like in your brain? And she's like, well, when I see my messy room, I can't even start. You know, so we're like, just clean your room to your kid. Just do it. That is so, I feel demoralizing to them because they want to, they can't. They don't know where to start. And so this darling patient was like, my brain is literally looks like my room. It's a mess and I can't see a way to start or a way out of it. And then she did start a stimulant and she's like, my room is clean. Now this is a perfect scenario, okay? It doesn't always go this well, but that makes me so happy for her. You know, she feels so accomplished in just getting her room clean. She's like, my homework is in. That surprised her too. Before she would wait, she's like, I would just stare at the homework. So when you walk in and your kid is just staring at the screen, they're not lazy. They're not trying to waste time. They literally don't know where to start. And so going back to that, they don't have the skill. It's not will. You know, there's that Harvard psychologist, Stuart Ablon. He talks about that, and I love it because they need a skill. So find out what skill is missing. Is it reading skill? Is it math? You know, what do they need help with? And if you don't know, then come to LÉVO. Come get testing. Come have an assessment, and that starts the path. And you might have to chip away to find the root of it all, but at least you're getting started. And I think it'll mean a lot to children that grow up and they're like, you took me, thank you. I'm gonna get emotional because my mom, she was working, so I was good at doing my little eating habits, you know, in 8th grade. And then finally, she didn't talk to me, she just took me. I don't remember having a talk about it. She took me in, and I'm grateful for that because intervention for eating disorders early changes the outcome dramatically. And I think that was probably scary for her. She didn't know what was going on. She had no idea. She didn't take me to a psych specialist. She didn't know. She took me to an endocrinologist. Because I had started having my period, and so she was like, okay, let's start there. So you just start. And then, I'm just grateful. So I know your kids will be grateful if you take them in.
One of the things that you mentioned there, I want to just go a little bit further in if you don't mind. You described care and the point of your mom taking you in, or other families who are struggling with ADHD or whatever it is. And I think that if your family has dealt with it, so has mine. I think we often think that the question is, well, should we involve medication, or should we involve care? You know, has it gotten to the point where we're going to need to involve care? And although that's a kind of a gateway or an opening door of questions you have to ask, I think that there's a set of questions behind that, which is medication or not medication. And that was the first question that we struggled with in our own family. But the question that we really should have been asking is, what are the pros and cons, and what outweighs the other? So in the beginning it was, you know, is medication worth it, or should we do that? And what we really had to address was, do the pros of focusing in school, not feeling overwhelmed all the time about a messy room. And because you have a messy mind, you don't even want to go to school because going to school just adds to the mess, right? And so in the beginning it was medication or not medication. In the end it was, no, we have to do a pros and cons list, and do these pros of focusing and the ability to be focused outweigh the cons, which is overwhelm, not functioning in your family because you're fighting over, I mean, of all things, like a messy room, right? But a messy room is just a symptom of a messy mind and life, you know? And so that question for us of medication or not medication, or treatment or not treatment, it really was, you know, a deeper conversation of, do the pros outweigh the cons? And they absolutely do. Whatever that treatment is, it is going to be key for a list of pros that just outweigh the cons of whatever the stigmas are, or whatever the fears are that get you from, we don't want to do that because X. Well,
but there's the other X. There's the other X. Like, you're the slow kid, maybe. I mean, for some.
I was.
You're
I mean,
the
I was
slow
labeled
kid.
that
You're
young.
the one that is, you know, going to this math tutor, which is fine. I'm just saying everyone sees that, and that doesn't feel good either.
Yeah.
And you're having low self-esteem, low confidence. Then it affects you socially because you're not feeling like you fit in. I mean, like you said, it's affecting relationships with other siblings and with parents. You know what I mean?
Yeah.
So all of that, you have to look at benefits and risks or negatives of doing the medication.
Yeah, the pros cons thing I think is really valuable, because you can't say, if we do nothing, then we're going to be fine, because the cons of that is significant,
And
right?
you might not see it right away.
Totally,
Right?
it's exactly
But
right.
they're
Yeah,
probably feeling it,
yeah,
or you yourself might be feeling it if you're an adult, young adult. Yeah, so you can just try, and if one path
Right.
doesn't work, there's just a lot of others that might feel better for you. But then you're not sitting with, or having your kids sit with that. That makes me really sad.
yeah. I mean, at some point, you're going to develop the coping skills, whether pro or negative, right? And so the byproduct of doing nothing is, then you better be scaffolding a lot of disciplined habits to fill the gaps of coping. Because if the stressors are there, and they're always going to be, you better figure out the solution. And that sounds very blunt to parents listening in, but at some point, whether it's treatment of some kind or other coping skills, you're going to revert to something.
Yeah.
Right? You're going to default to something.
And those are not always okay or welcome in homes or marriages, such as gambling, which I know sounds dramatic, but this is true. Those activities that are getting that dopamine hit, right?
Yeah.
Shopping, and I know people are like, yeah, I just like to shop, but that could be to get that high. Pornography use, substance use, this is why, what's the root of those?
Right.
You know?
Well, the most socially acceptable of the bad coping, right, is adrenaline.
Yeah.
So what is my byproducts of not getting my coping positive when I was young? 4 knee surgeries, back surgery, shoulder surgery. I grew up in physical therapy because my racing mind needed a fix. I needed to slow down. And so what did I do? I skied off cliffs, and we laugh about it, we joke about it, but the reality is I was not chasing being an incredible athlete. I was trying to slow my mind by moving. And the most socially acceptable, cool way, I'm now known as an extreme skier. That's what I did to cope with a racing mind. And it was fun, but I now have all of these injuries, and I wake up sore every day. So you can either scaffold positive coping early, or you're going to adopt lots of habits and behaviors, that may not necessarily be positive.
Right, absolutely.